Good afternoon, everybody. Thank you for being here. I'm joined by Dr. Corona, President and CEO, or what's your official title, Doctor? CEO of Upstate. Certainly, there's been no better partner to us than Upstate throughout the pandemic. But let's go over some data points. No new deaths since yesterday, so good news. Again, 205 of our neighbors that we've lost directly related to COVID-19 during the pandemic. I'm going to break out testing numbers. It's important and critical that we understand the way that testing is being done in this community, specifically because we need accurate data to make accurate decisions, and that's how we've handled the pandemic, the whole process. So when you take the reported cases on a daily basis from Onondaga County, and the numbers differ a little bit from New York State, there are duplicates. We've talked about times where in order for people to leave a hospital to return to a nursing home, they need to test negative for a COVID test. We know it takes a period of time for that to happen, so if that person were to test positive after they were already positive, that flows through the state system. We don't count two positives for the same person. We don't count two positives, someone gets a positive and they want to take a second test to do that. It all flows through the state system. So each day there are small differences between what the reported cases are in New York and what the actual cases are. In addition to that, the reported cases each day now come from both saliva and diagnostic tests. New York State's website has yet to update all of the saliva tests that are done to get to those positive numbers. So, for example, yesterday we had 16 cases. There was 10 cases that we knew about those cases because we did a saliva test. But we just didn't do 10 saliva tests for the 10 positives. We did thousands of saliva tests. So on the New York Forward page, they have yet to update the thousands of saliva negatives, which you need to if we're going to look at accurate data. So we're going to give you the data, and I think the state's working on that now, so we're very thankful for them to look at that. But 7-day average, if you just looked at our positives that report and diagnostic tests, again, even though some of those positives came from saliva tests, if you looked at that data point, our 7-day average is 0.75%. In addition to those tests, all of our colleges in our community, Syracuse University, ESF, Upstate Medical, OCC, have performed over 19,200 saliva tests over the last 7 days. So there's 19,000 tests that are finding these pockets of this virus, but they haven't yet been put on the New York Forward page. And that's what we're asking them to do, and we think they're going to do that. So when you add up all the tests, and you look at, in addition to that, we had 1,479 saliva-based tests founded right here at SUNY Upstate over the last 7 days as well. You add all this up, between the colleges, our own school district testing, there have been more than 20,675 saliva tests in the last 7 days. And so why it's so critical is because before, when we were doing all of our testing with diagnostic testing, that was the way we're doing it. Because diagnostic testing is more expensive, and we have now SUNY Upstate able to essentially process 120,000 saliva tests, is it a week? A week. Why wouldn't we want to use our own lab right here? And so we have transitioned to now well over 50% of the tests in Onondaga County are being done saliva-based. If you look at SUNY Oswego, SUNY Cortland, all of our other SUNY schools in the central New York region, those saliva tests are being done and processed at SUNY Upstate. So when you look at some of the data points coming out that I know get some headlines, if you want, it's skewed right now because you're getting all the positives from the saliva test, but you're just not getting the thousands of negatives. So when you factor all that in, we've had, from the pooled saliva test in the last 7 days, there's been 39 positive cases out of our 95 cases overall over the last week. So almost 40%, maybe a little more than 40% of the positive cases in the community have come from the saliva test. And when you factor in the diagnostic and pooled saliva tests, you add in all the tests being done, and then you add back in all of the positives, our 7-day rolling average for all tests in our community is 0.28%. So a very good number, and certainly just really, really proud of the work that's being done at SUNY Upstate for helping us fight this pandemic. Looking at hospitalizations, 12 individuals in the hospital. There's 2 individuals in the ICU out of our county community. Certainly, let's think about them, keep them in our thoughts and prayers. When you break out the 12 individuals, 8 Caucasian, 4 African American. When we look at overall positive cases, we've had now 3,969 positive cases since March 16th. That's up 16 since yesterday. Of the 16 cases, 3 were travel-related, Ohio, Virginia, other part of the state. There's 1 case still being investigated. 12 of the cases were community spread, 6 of them known sources, and out of our 16 cases, we had 6 cases out of the 8 different higher education institutes that we track. So 6 out of 16, and out of our 16, 2 of the cases came in from out of jurisdiction higher education institutions. So these are our residents that went to college somewhere else, got COVID, and are recovering back in Onondaga County. So then our health department takes the case over and monitors and makes sure that the isolation is lived up to. So that's a breakout of the positives. Our active cases, 140 active cases. Recoveries, we had 1 recovery since yesterday. When we look at who has been sick, 2,282 female, 1,687 male, 377 under 19 years of age, 827 in their 20s, 520 in their 30s, 468 in their 40s, 589 in their 50s, 434 in their 60s, 314 in their 70s, 278 in their 80s, and 162 in their 90s. Related to back-to-school testing, and again, this is a big deal. Not many communities are in front of this issue and putting in the infrastructure that we are to make sure that we have a successful school year for our kids. We know we want to give the districts the tools they need, give the faculty the tools and the comfort, and parents the comfort knowing that their kids can go to school and they can learn and be safe. And we've shown great resilience as a community. We've gotten to the point where we're opened up. Now it's keeping schools open. And the best way to keep schools open is to do what we've done with our other industries, and that's test. We know that over 99% of those who are tested do not have COVID-19, but they are sick with something else. We are the state, and locally we hold ourselves to higher standards in schools on ways to deal with this. One of the key things is making sure that when we have a symptomatic child or faculty member that's in the building, is that there's a quick designated turnaround time for that student, that faculty member, so we quickly know if they have COVID, so we can do the contact tracing and quickly make decisions on how, what the next appropriate step is for that building with that administration. But also for most of the children who will get this test that had something other than COVID, they can then quickly get back to school, assuming that they recover from their symptoms. So we can't have delays. So we're happy today, we talked about this, to announce a partnership for our testing program for symptomatic students and faculty. Dr. Crone is here to talk about this with us, but essentially the details are as follows. The Upstate Mammo Van will be at NBT Bank Stadium Mondays through Fridays from 9 to 1. The individual can set up the results are going to be available through an online portal that Upstate does. We can schedule appointments at the phone number, and I believe there's a phone no? Nope. Phone numbers, yes, there is a phone number. There's a phone number, 315-464-2582. You select option 4 to get this scheduled. And again, we'll be talking about this. This will be up at all of our briefings moving forward. But the idea is that you pick a time that works for you and your schedule. You get your child tested. Within 24 hours, essentially, Upstate will have a result of the test, and then we will be alerting you of what the result is. Any child under 18 must be accompanied by an adult who can provide parental consent. And so we've developed this. We got school. We've had, as you know, a couple cases. Contact tracing went well throughout all of that process. But we're going to have more cases. We're bringing people back together again, and this is going to happen. So it's about building up the infrastructure and reacting swiftly. At this time, I'd like to ask Dr. Corona to come up and say a couple words, and just want to thank him and thank Mantosh and certainly Dr. Middleton, Dr. Thomas, Dr. Anderson, all of these doctors who have helped us as a community get through this. So, Doctor, please come on up.
Thank you, County Executive. Really appreciate the collaboration. It's been a tough 6 months, and I have to tell you, the collaboration that our university has had with the county, I think, has been remarkable. I've talked to CEOs around the country, and I don't think we've seen anything like the relationship that we've developed with our academic medical center and our county. And you can see by the results. We have a responsibility as a teaching hospital and an academic medical center to develop new tools, do research, teach, and take care of people. And I think this is a prime example where a test was developed to make it nicer for the patient because you're using saliva instead of the nasopharyngeal test. It's quick, it's extremely accurate, and the results get out to an individual so that they can make a decision quite quickly. And this partnership with the county to serve this region, I think, is pretty unique. And we intend to continue this moving forward as we come into the cooler weather and the winter season, that we'll be ready to provide testing. And we just had a meeting this morning about our Incident Command version 2 so that we're ready when the vaccines come out, whenever they do, that we can start to distribute them and continue to test and keep this region safe. So once again, I want to thank County Executive Ryan McMahon, Ann Rooney, who we talk frequently on the phone, and everybody who's been helpful. We have a great group of professionals working at Upstate, and we feel it's our mission to serve this community. So thank you.
Thanks, Doc.
Yep.
We're very lucky to have Upstate. You've heard me talk about the fact that we're one of 8 communities our size in the country that did not receive CARES Act funding, and other communities received well over $100 million. But because we had Upstate and Crouse and St. Joe's team up with us very early on, we're able to do things and put ourselves in a position to succeed. And because of the innovation at Upstate, we can continue to innovate with our testing protocols and programs to continue progress with this unique set of circumstances we're under. Questions? Yeah, in some cases they'll be back quicker, depending on timing when the test comes into Upstate and they process it in different shifts. But essentially, very quick turn time. And the saliva test, we think, from the standpoint of parents being comfortable participating, it's a lot less intrusive than certainly the nasal swab. Is it a Monday, Dan? Yeah, Monday? Yes, it's going to be open up on Monday.
The diagnostic version of the saliva testing was still pending FDA approval. Does that have anything to do with the testing, or is it going ahead now that it's got State Department of Health approval?
Yeah, no, we've been doing this. The saliva test has been the dominant test in our county for over a month, hence why our numbers are different from New York forward. So eventually I believe that the FDA approval Is this test still under that process too?
I'm not sure, it might still be pending. The only problem they had was the labeling on the swab, but the function of the test is solid.
Yeah.
So it's the design, the digital designer's fault, right? I'm
Yeah,
just
yeah.
kidding.
So New York State DOH has given their approval for this. So what happens is when you do the test and you do the pool, if there is a positive within the pool, the old rule would be you would go and you would retest the pool diagnostically. But now the positive just becomes a positive and shows up in the state data and the Eclair system, then comes through to the county of Onondaga. And so that's really critical when you look at tracing, contact tracing, and turn times. And from a resource standpoint, the saliva test is much more affordable than a diagnostic test with its processing.
What does this do to the operation within a school? If you get results the next day, you can obviously contact trace sooner, but what will that allow for schools in order to decide what happens next?
Well, this really doesn't change that process, Andrew. I think what this does is it gives our contact tracing more time to circle in a potential issue. And then based off of that information, our health department makes an assessment on each case is so different. We've talked about all this. And then based off of all that information, the health department makes a recommendation to the district about what kind of exposure the school had. But time is our friend on this. So fast turn times, a dedicated site for this circumstance, clear and crisp communication to families, a saliva test, not a nasal swab. All of these things will help drive participation in better results for the community at large.
What makes schools so important that you decided that that is what needs a dedicated site and a dedicated test versus other employers or places in the community?
Yeah, so what we're doing, Trish, is we've learned from what works well with colleges. We did part of that with colleges when you did the back-to-school testing with the schools and the colleges, did back-to-school testing, the ones that had successful openings. We know that there still needs to be a screening component in the schools for testing. We're working on that with our partners, and we'll probably talk about that next week. But this is, from the standpoint of symptomatic testing, most of the symptoms, COVID-19 has lots of symptoms, right? So these kids are most likely sick with something, and in many cases, even if they're not COVID positive, you don't want them in the school until they're better, because kids get sick all the time with different things. So this addresses the most likely candidate to present COVID into the buildings and does it quickly. And again, the screening process will then search out the asymptomatic case that could present a problem for districts. But if you look at it, these are our children. These are areas that you're talking about buildings with more people in them. And we know that leads to a little bit more risk. And we know how important it is as a parent to get our kids back in an environment where they can start to learn again. And in addition to that, you're talking about school being a safe place for kids to be during hours where most employers have people working. So we're all so connected in this process to schools, in society, how it works. So we're going to pull all the stops out to make sure this goes well.
Your strategy has been so focused in these later months on asymptomatic testing. This is kind of not changing strategy, but now zeroing in again on symptomatic testing. Do you expect it to be busy, or might it only see 1 or 2 people a day?
We'll see more, because going into the year, the part of the year we are, you're gonna see some of these other influenza viruses pop up. Asymptomatic testing is still a big piece of our strategy, because you can find that hidden pocket, and that hidden pocket can turn into quite a few cases. But this is the immediate need today, and we're putting together the screening process in the near future for districts. So that's still going to come out. We'll probably unveil that, like I said, later next week.
That's an important point. You're expecting symptoms of everything to start popping up. This
Sure.
is a way to identify COVID or not very quickly.
Yeah, you're bringing kids together again that probably haven't all seen each other, so they're not all used to each other. That's going to lead to all sorts of little things with our little people.
Is this testing free for families, or should they bring insurance cards?
Bring your insurance cards as well. This symptomatic test would be something that insurance will cover. As we start doing the asymptomatic screening, certainly that's not going to be a cost to the parents.
And it's a pooled test, but there's also an individual sample preserved for each person?
This, I believe, is an individual saliva sample.
So, I'm sorry?
This is an individual saliva sample. Yeah.
What options do families have if they don't have access to health insurance at the moment? Would they still be able to use this
Yes.
site?
Yes.
Would it be at any cost to them, or?
No.
Okay. And then do you have to be able to prove that you're a student with a public school district somewhere in the county?
Yeah. Well, the process how this works is essentially you're going to have, again, there's policies in place with the districts to try to eliminate that sick child from coming to school. But a child can come to school and then develop a fever later on in the day or other symptoms in the day. And so then the nurse will work with the parent, and the nurse will be part of our communication team to get them here, get them the phone number, call, get an appointment. This happens 9, 10 o'clock. Get in later that day, later that morning, come over, get your test, and then the next day you'll find out what we're looking at.
So is it more coordinating with the school, or is it a case of if you wake up and you see that your child might have symptoms, can you then go circumvent the school, or does the school
right?
need to make contact?
If a parent if their child had symptoms in the morning, this is more school based at school. Think of that, but certainly this can be open to any child related to that.
Is the health department or other county employees checking schools to see how safe they are, kind of like you did with gyms and other businesses?
Yeah, we speak with the superintendents on a daily basis. The communication with the health department, we track obviously all of our cases. They know more than I know, but even I know where there's cases now related to our higher ed and our lower ed. So these things happen every day. And certainly our own health department is working with the medical professionals, medical directors in the districts that have them. But this has been a true partnership with these superintendents. This is not something they've had to do. This is what we do. Normally we aren't involved with schools really as a county as much. We have support systems for mental health workers and social workers in the schools, but we're in a pandemic. And so this is part of what is necessary to keep these buildings open, and we'll step in and fill that void.
But are you checking like the actual buildings to make sure that they're following all the guidelines of desks spaced apart? And
yeah, we're
that
not
kind of
doing
stuff?
inspections there. The superintendents themselves have to attest to these things personally with the State Department of Health and State Department of Education, and so they're going to make sure that everything's done properly.
The 0.28% infection rate, is that the lowest in Onondaga County in 6 months?
Yeah, so when you look at, it probably is, but when you look at the framework of how there's a lot of asymptomatic testing going on there, right? But that's what a real positive rate is, right? The real positive rate, if we want to know what symptomatic test rates are, we only test the symptomatic individuals, and they'll be higher than 1%, right? There's no question. But that doesn't give you the impact of the community at large. So you need to proactively search for those asymptomatic cases, and so you need to get a good number of asymptomatic tests into your sampling. And so this is probably over testing asymptomatic individuals, because you're literally testing every SU student or close to it. But at the same time, from a statistical standpoint, you can't take all the positives from a saliva test and not count the negatives. And so when you look at everybody being tested in the community, yeah, 0.28, very, very good. And who knows, if we tested 467,000 people in one day, maybe we get the same number, maybe even be less. But right now, we're in pretty good shape. If you think about, I know that the cases. We look at the number of cases from colleges each day that are positive, but you got to look at how many are negative too, because the massive amounts of students up on these campuses that don't have the virus, and the contact tracing that's being done on our universities and college campuses in our county are really, really strong efforts.
Our new number seems to be 16 positive cases a day.
With 3 in a row? I think it's different tomorrow maybe, but we'll see.
Brian, put that in context. I mean, because I know every time people see 1 or 2 pop up in schools or up on campus, I think it worries them. But I mean, are you still pretty content with where we are?
Yeah. What's scary is when you're getting cases and there's not a narrative behind it, and you don't know if you had a cluster, if you wrapped yourselves around it, and the cluster's over, right? And so when you look at Syracuse University, they had a little pop in cases. Normally, if they started out the year with 13 cases on day 1, it's not bad. 13 cases, 18,000 students. But when you start off with 1 or 2, and then you go to 13, you're like, oh my gosh, what happened? So it's all about perspective and balance. There's a narrative behind that. You had students leave Labor Day weekend, leave the bubble on the Hill and the bubble around the Hill in Onondaga County, and go to another campus. And I don't know what they did, but I know they came back with some COVID. And so they come back to our bubble, and then it took a little bit of time before they became symptomatic. You get tested. We know what they have. Now we contact trace. In that time, they spent time with friends, and so that's how the story starts. So the good news is that because of that, we know we're going to have more cases, just like household contacts, because these kids live in dorms. But we've got our arms around it. And if we didn't have our arms around it and it's coming at you from 15, 20 different spots like it was in the beginning, that's when you're really, you're not being surgical with your strategy. You're really just trying to limit the damage. So right now, if you look at what we see, we're getting cases related to college. That's part of what we get every day. We're getting travel-related cases, starting to go down compared to where we were 3-4 weeks ago. We're always going to get household contacts, and we're always going to get community spread. The good news is that our senior facility cases are down and have been consistently down, because that's the direct correlation between those cases and our hospital numbers.
Can you give us an estimate on how many new cases are symptomatic?
Today, most of them were. Today's 87% were symptomatic today. There were 2 or 3 days ago, I think you had one day where I think 55% or something were asymptomatic. You'll get days like that, but most of the cases, the last few days, the supermajority has been symptomatic. Tim, you had a question?
The 0.75% positive rate, that is for diagnostic nasal swab tests?
So what that is, and we probably need to break it out differently, but that is all the positives we have that are reported with diagnostic tests only. So the saliva positives are in that number still. So that's basically the New York State diagnostic reported test with the actual positives in the community, even the positives that are saliva. And there's a difference. Remember, some days we'll have a couple more than what New York State reports. That's usually a timing issue when we have more. Often what we've seen since the start of college is we've gotten cases that end up being transferred to another county, and the double test. What happens a lot of times is you'll have young people who are asymptomatic get test positive. They don't believe they're positive because they're not sick, and so then they get a second test. And so if we get 2 positives 2 days in a row from the same person, we know that there's only one person. So.
And you think the state DOH is going to go to a system of reporting the pooled tests as well? I
do. I think they will. We've talked about it in the control room, and certainly I think that there's just a way they have to figure out how to report it in through their system. But I think they would agree you can't 120,000 tests a week at the SUNY campuses across the state produce positives. You can't ignore all of the negatives that testing reports. And I think it will just further show the great work New York State has done overall, because New York State's rate will certainly drop once the, right now you're seeing, go look at all the counties that have community colleges or SUNY campuses, any college campuses. They've seen little upticks in testing. If you're not getting the negative results with them, your data is just going to go up because you're just getting the positives. So for those counties that host SUNY campuses, that's what's happened to their data. So it's artificially moved higher.
How confident are you in the strategy that you have here with the colleges? Because I know a lot of people look around and see some surrounding communities and the numbers and the cases at those colleges, but you seem to be pretty confident with what's going on here.
Yeah, I think, I think the rule is the 100 or 5%, I think is tough for us, because that 5%, usually that's a good one when you got 100 people is about 5% of the campus or close thereto. With SU, when you got 18,000, 100 is what? So I think it's a tough rule for us. It hurts us because I don't think 100 cases on SU over 2 weeks is an emergency situation. Saying that, SU recognizes that they need to be better than anybody else because of this rule. And so they have been better, and they've done more. And if we didn't have some students go away on Labor Day weekend, their number would be a lot smaller right now. But that shows you how fragile this is for the community at large. Overall, this is still around, still here, and it's certainly in other parts of the country, it's more prevalent. So there's risk with that. So it's just being safe. If you're going to travel, be safe, put yourself in positions to succeed, and certainly watch your symptoms when you come back, get a test, and lessons to learn from. But overall, I feel good where we are with colleges. I mean, we've been open for over a month, right? We have over 25,000 students, and we've had 68 total college cases, well over 30,000 tests. So do the math. It's pretty good.
Are there still only the 2 infected students within schools that we talked about on Monday?
There's one other case related to a student. The student was not in school when they were sick, and contact tracing efforts have been done, and there's been no impact on the school building.
How many people are in isolation or quarantine as a result of those positives?
The 60, which ones?
Sorry, in the Baldwinsville School District.
We don't go over the specifics of those. And what I was just referencing wasn't Baldwinsville.
Oh, sorry,
Yeah.
excuse me.
Yeah.
What options do students or families have if they're asymptomatic?
So what we're doing for asymptomatic testing, at any time you can go take your child or yourself to go get a test. The question is, if you're not sick with certain symptoms, will insurance cover it? So you may end up getting a bill for $125 or something later on if insurance doesn't cover it. So what we're doing specifically for students and faculty in buildings is we're going to come out with a screening program for testing, just like colleges are doing surveillance testing. And again, that'll most likely be next week. And they won't have to worry about the cost of that. We'll work on the cost of that up front, and then hopefully we'll get some help, or the schools will get some help from the federal government at some point, and then they can help participate in that cost as well. Anything else?
The comptroller had mentioned that it would have been helpful to be able to get that funding in, if not for the lower population below that 500,000 threshold that we needed. How critical would that funding have been if it were able to come in?
Well, you're referencing the CARES Act funding?
Yes, yeah.
Yeah, so if we had, it's all hypothetical, right? These are fun hypotheticals, but if we had $120 million, like Monroe County, to go fight COVID, Dr. Corona would have came out with a saliva test probably a month ago. We would have rapid testing everywhere, and I could probably arguably say to the governor, we're going to go watch football in the Dome because I'm going to test every person when they go in. The reality is we were one of 8 communities due to a policy at the federal government. And I get you got to cut things off somewhere, but it's 500,000 population gets direct aid if you're 500,000 or above. We're at 467,000 today. So there's only 8 communities in the whole country between 450 and 500,000. And so those other leaders probably feel the same way I do because they have the same problems that those communities slightly bigger than us have, especially during the pandemic, yet we did not get the same resources. So that's why our partnership with Upstate has really helped us.
And then in the same vein as funding, do you have any sort of update on how many employees will be voluntarily furloughing themselves or layoffs?
Yeah, so we are looking at that number. I don't know how many voluntary furlough employees we have. We have had close to 30 employees take the second chance retirement incentive. So that's going to save 30 jobs. But we'll have updates on that in the near future as well. Certainly, we've been on borrowed time on this issue, and so decisions are going to be made in short order.
Do you think the census 10 years ago could have gotten you 50,000 more people?
I don't know. We've had some, with our new American community, we've had some growth. People are born every day, people die every day, so I don't know if we would have gotten there. But I think you can argue that threshold should be lower. There's not many counties that are over 250,000 people in the country. So those ones that fall between 250 and 500,000, tough spot to be in.
You mentioned football in the Dome. Have you had any conversations on the control room about if they're allowed to play football in the Dome, and any conversations about letting at least family of the players into those games?
So week 1, there's no fans, right? So that's been determined. We're having conversations with the state. I think limited fans with a negative COVID test is a pathway to maybe get somewhere, not just for Syracuse, but I know in Erie County, they've got a team called the Buffalo Bills that I know they would love to get some people in the stadium there too. But I think with situations like that, testing needs to be part of the equation. And if you have a test, you're distancing, almost 99% sure most people don't have it because they've been tested, and then everybody's distanced in a way, and you have limited fans. I think it probably can be done, but we're not quite there yet.
Also, this week marks six months since we've been doing this, and there's been COVID in the community. What maybe surprised you the most, or the biggest thing that you've learned in that time?
Wow. That's a reflective question. I might need to answer that tomorrow. But the nice thing is that if you look at the way the community's been tested and challenged, we've done a nice job here in meeting the challenge, even when we didn't believe in what we were being asked to do. And so I think we've had a unique position in our role of feeling that anxiety and that pressure, because we were the ones that people would reach out to and share their opinions with us. So it's been really impressive to see how the community's responded. At the same time, it's been challenging when you feel that anxiety on each issue, and you know you need to come up with a plan or a strategy, and it needs to work. And there's been many points along this way that with our partners we had to get it right, and knock on wood, we did okay. So it's been a process, and we're not out of it yet, but we're getting there. And if we can get through this, there's other challenges that our community will face, and we'll be able to get through those too. But we got to keep our heads. We've said that no politics in pandemics. At the local level, we've done that, and I think that's why people have trusted the decisions that we've made, and they've sacrificed when we've asked them to sacrifice. Anything else? I want to thank Dr. Corona, our great team at Upstate, and the community, and we will see everybody on Monday. Thank you.